Hey, my name is Tess, and my topic is genetics and diabetes. So, type 1 diabetes is diagnosed when there's a certain level of elevation and in blood glucose, and the pancreas rejects making insulin. So, the two types of blood glucose levels is hyperglycemia, which is when the blood glucose levels are really high, and hypoglycemia is when the blood sugar drops below a certain level and it's really low. There's no cure but processes that make life a little easier being a diabetic. And these are some type 1 diabetic fast facts. So, type 1 diabetes affects about 1.6 million people in the United States. Type 1 diabetes also can be triggered by any virus, including cold. Most people with type 1 diabetes are diagnosed in the ER as children. People who have type 1 diabetes require insulin, and this is usually like a constant thing, so it's not like, even though people have this, they have to have insulin 24/7. So type 2 diabetes has a stronger genetic disposition than type 1 diabetes and like pre-gestational diabetes. There's 75 independent loci shown for dispositions. Environmental factors, just like type 1 diabetes, are still a role included in type 2 diabetes, and genetics and epigenesis can interact with each of the pathogeneses of type 2 diabetes as well. Type 1 diabetes is more of the body doesn't make enough insulin. It can develop at any age, and there's no known way to prevent it. Nearly 18,000 youth diagnosed each year in 2011 and 2012 with type 1 diabetes, and this has been more prevalent over the past few years. There's been an increase in diagnosis of type 1 diabetes over the years, and in adults, type 1 diabetes accounts for approximately 5% of all diagnosed cases of diabetes. Type 2 diabetes, your body can't use insulin properly. This can also develop at any age. In most cases, can be prevented with a specific diet or just a specific pill that the doctors give you to take. In adults, type 2 diabetes accounts for approximately 95% of all diagnosed cases of diabetes. More than 5,000 youth diagnosed each year in 2011 and 2012. So a lot of people think that type 2 diabetes is just in overweight people or just in adults, when in reality it could be anybody. 1.5 million people 18 years and older diagnosed in 2015. So the genetics of type 1 diabetes are very few and far between. There's many different choices and causes of diabetes, but genetics is definitely one of them. Genetics is more of like if your parents have it or if it's in your family line, then you're more susceptible for having diabetes. So the causes are genetics, environmental factors, the microbiome, and the immune system. Genetics would be like your family line or someone related to you has diabetes and it passes down to your generation. Environmental factors are there's very many environmental factors that could lead to diagnosis of diabetes. This could include certain weather changes if you live in a certain area of the United States, or if you are born in a certain season in the north. Diabetes is an autoimmune disease, so obviously it's going to affect your immune system. And that has been very important here recently with COVID and COVID infecting your immune system, or you're being more susceptible to getting COVID if your immune system is down, or if you have something that's weakening your immune system like diabetes. Diabetes also has a genetic uprising, and this chart just shows the number of people at risk, and as the age increases, it shows like how diabetes affects you at different ages and the number of people at risk or your antibodies. So the pathogenesis of type 1, this guy named George Eisenbarth, he made a model that plotted the B cell mass against their age, and it pointed out the sequence with genetic risk for being diagnosed, and this pointed out the environmental triggers as well as it followed B cell loss. So the chart shows age and the B cell mass, so you can see that the B cell mass increases and then it stays about the same, and over a period of time as age increases the B cell mass decreases. And there are also different risks of diabetes, and if you're a certain person, or if you have like a certain family line with diabetes, then you're at a different risk than others. So diabetes is obviously a heritable disease, which means it can be passed down from generation to generation. There's identical twin concordance of 30 to 70%, so you're 30 to 70% more likely if you're a twin to have diabetes. If you have a sibling with diabetes, that puts you at a risk of 6 to 7%, depending on like if your sibling has it, or if you have it if you have it personally, then your sibling has a 67% chance of getting it. And there's also a risk of 9% for children who have parents with the disease. So if your parents have the disease, or if you're someone like in your immediate family that has it, you're at 9% risk for diabetes. And diabetes is also more likely to occur in men and boys than women and girls. There's also been a lot of research done on whether or not genes really played the most specific role, or if environmental factors or interactions have a factor on the different pathogenesis of diabetes. This is also whether or not loci at different positions or independent loci have causes of being diabetic. So the research was basically done on whether or not genes have the most important role in the diagnosis of diabetes, or if it's more of environmental interactions, or if it's more something in your genes like the B cells or different loci at different positions. So there's also a lot of diagnosis and causes of diabetes. Children who are in the age range of 10 to 14 are the peak age for diagnosis of diabetes. This can also still be present in adults, but type 2 is more prevalent in adults, which doesn't mean it just stays in adults. It's also prevalent in children, but it's more likely to happen in adults, while type 1 diabetes is more likely to happen in children, but this also still carries on to adults. The causes of diabetes could be injury to the central nervous system, familial disease, which we've talked about before, or idiopathic cause. It could have an idiopathic cause. And here are some of the symptoms of diabetes, type 1 in particular. You can have frequent urination, which is later on a symptom of high blood sugar. So the frequent urination is a symptom of high hyperglycemia. Irritability is easily a symptom depending on what your sugar is. You could have extreme weight loss, increased thirst, which is a symptom of high blood sugar as well. Fatigue and extreme hunger, which is when you have hyperglycemia and your sugars are below normal, and also blurred vision. Relation to the course of genetics, there are many human genetic disorders that are polygenic and monogenic, which are diseases that could result in single base pair changes. Monogenic diabetes is just one example of those. It's a rare form of diabetes that shows just one base pair change that can result in many different diseases. And this table shows the treatment options for monogenic diabetes. So those include diet, exercise, insulin, and those are also very common in regular type 1 and type 2 diabetes as well. Ethics in diabetes also have a big role to play. Ethics is more of like how people react with things going on in their society. So there have been many ways that different there have been many different ways developed over time to aid the process of diabetes, which is really just something that helps move the process along a little bit easier than before, because in reality diabetes has no cure, so there's no way to completely stop it, and no really preventative measures, but processes have been created to not really slow the process, but help aid the process and help make life a little bit easier. One of the most common therapies is insulin, of course. Once you're on insulin therapy for so long, it kind of makes life normal, even though some things are a little different still, obviously, but you just have to monitor your intake of foods and carbohydrates and sugars. The CGM was created, which is a continuous glucose monitor, and it allows you to have your sugar regulated 24/7. You wear it just like a port in an insulin pump, which is also another reason. It monitors your blood glucose levels 24/7, and it aids sometimes, like when your sugar is really high, it can give you insulin. If your sugar is really low, it can stop the use of insulin. And also another resource is the insulin pump, which at first you're going to start out on shots, but the insulin pump has all your calibrations and numbers already calculated into it so that it can make life a little bit easier for you, and all you have to do is key in your carbohydrates. So while these are not really preventative measures, they just allow life to be a little bit easier having the disease. And then these are my references.